Good evening, everyone. My name is Al Dull, and I'm the president and CEO of the Urban League of San County. And this is our second in a continuous series of fireside chats to discuss health disparities and equities in our community. And as I said the last time that we met a couple of months ago, this is about you. It's not about us speaking at you. It's about all of you engaging with our esteemed panel here to discuss the issues, the medical issues that are most pertinent to you and your family members. There is no script. I'm going to introduce our esteemed panel, and then we'll turn it over to the panel to introduce themselves a little bit more in detail. But again, this discussion to just share where we can be better, how we can be better, how we can actually move the system to meet your needs, at least your bed. To my right here, we have Zach Brothers. He is the vice chair of our board, our hazard executive. We have Dean Watson, who is the executive director of Mental Health America, San Diego. We have Dr. Ron Robinson, retired cardiologist. I never really retired. He's not there ever retired. We have elderly upstairs, represents some wonderful nurses. My mom was a nurse, so especially smart for nurses. And we have Dr. Banji, who is the end all be all of everything. I read Dr. Banji. And I know we have a couple of the board members from the early in the audience. We have Dr. Rob Brown here. Thank you. And thank you, Dr. Brown, for coming. And he has Oliver Jones representing. Yes, thank you, Oliver. And Oliver also brought Brown to guest with him, Leo. So I want to thank you all for coming. And at this point, I want to turn it over to our panel. So, thanks.
Okay, well, I would like to first of all welcome all of you for coming out today. And I am the co-chair of the Health and Wellness Committee for the Urban League of San Diego County. My other co-chair is Dr. Robinson, and the panel, it's still on our Health and Wellness Committee as well. The committee was put together to really look at the health disparities, the lack of access, and the issues that we are facing in our communities for people trying to get health care, mental health services, and anything else that's supposed to come from the county health department. And what we're finding is a lot of barriers. So we'll talk about those barriers today. We'll end with you on what you see with this barrier that you try to receive health care. So before we start, I want to turn this over to my panel so they can tell you a little bit about themselves, and then I'll give you a little bit about our agenda today and talk about a little bit about what we talked about in the first fireside chat, community meeting, some of the issues that were brought up, and some of the things we've done to that point. So,
you will. Thank you for doing.
Hello, everyone. My name is Daphne Watson. I'm the Executive Director of Mental Health America, and it's a pleasure to be here today with all of you and talk more about how we can, as a community, and also as individuals, really make a difference and improve the care and the support and the systems to physical health, mental health, emotional health, and it's such a critical thing right now. Our agency really focuses on the disparities between employees of color. We try to fit the lane in really supporting people to get to the right services, or we provide a direct link to them. But we can't do it alone. There's a whole lot of us, all of us, need to be in the process of really supporting and helping our communities get better and understanding what isn't there. There's a lot of services out there, but most of them won't be open out. And so therefore, we suffer in silence. And I know I'm a believer that people of color, families of color, children of color, really need to get the services they need to be counseling and out. So I know our conversation really have to heighten the disparities, the challenges, the gaps in care, how we all can work together to change.
the big news stuff.
Thank you. My name is Jerome Robinson. I'm a retired cardiologist, interventional cardiologist, and also hypertension specialist. Uh, I have a different take on this since I've been practicing in the South Bay community for over 40 years. In fact, I just retired in December. And my take on this is that a lot of information about healthcare is just not there. My also take is that the system was never built for us to begin with. And so how do we better make the system work for us? And so we put this meeting together, several more will probably do, so that we can get information from you, the users of the system, to find out what are the problems that you've experienced in trying to deal with the healthcare system. How would you like to see this healthcare system reimagined, particularly as far as mental health is concerned? There are a lot of issues with regard to mental health. We're going to bring out some of those tonight, and we're looking mainly for information from you. This session is recorded. We will compile the information we get from you. We will put that information together. We will take that information to the county. The county is responsible for healthcare in the city and the county of San Diego. And so hopefully we can begin to make the change that's needed to be made so that this system can service you as best it can.
Hello, everyone. My name is Samantha Williams. I'm a family nurse practitioner. Been in nursing over 20 years. I'm also the co-founder of Gyra Providers, and executive director. And our organization works on providing a lot of workaround opportunities and solutions to some of the healthcare inequities that we see in the community, and to be a resource for the community in terms of the needs that they have. Our most recent initiative was focusing on COVID-19. And as that has wound down, we've now begun to refocus our health initiatives on cardiovascular disease, obesity, nutritional health. And so everything that we do is all about community power. We believe in being a voice for the community. And so happy to participate in this event because it's all about collaboration with the community, making sure that as we move forward, we are coming from the voice of the community. Thank you.
Hi, my name is Dr. Vanjie Akridge, and I am a licensed educational psychologist. The field of licensed educational psychology is an interesting mix between being an expert in child and adolescent development, educational law, and mental health. So there is an interesting cross-section of expertise that I am required to have, which makes me a very unique resource both to the community and the families and children that I serve. My primary support is to children and families in K-12 education, but of course I also support adults who have learning differences or mental health challenges that impact their ability to access education or vocational training. My primary reason for being here is that because my field is so very specialized, for people to access my services, I can't begin to tell you the hoops they have to go through in order to be able to come for a visit. It's often something that is out of pocket, which is very unfortunate. And we're talking about the most impacted students who are, most severely disabled or impacted by mental health challenges that need this level of expertise, but unfortunately are unable to access it and have to go to someone, not to knock my colleagues, that have a more general scope in their practice. So I really think that it's a conversation to be had, especially when we talk about populations, specifically our children of color, when it comes to being in special education, the achievement gaps, the lack of educational attainment, and how that is translating into, job security and, economic development if we aren't having these honest conversations about the lack of access to the resources that, should be available to our families.
Thank you, Bell. So before we get started, I want to kind of go over the agenda we have for this evening and to kind of echo what Robinson said. We are taking notes. We took notes in the last meeting. Those notes were posted on the Urban League website, so you can actually look at what we talked about, some of the recommendations we had talked about trying to do, and we look forward to say they will have any this meeting. So I want to talk about the agenda. We're going to review some of the topics we talked about in the first meeting and some of the recommendations that we made to find out where we are. We're going to preview a Black and Brown mental health registry, a directory that we're putting together, then post on the Urban website as well. And each one of those individuals and embedded by there to be ensure that they know what type of patient they're calling, who's going to be calling, and making sure that either they have health insurance or something that their county is in there. They're in the county payer system, so they can access them or services. So what we try to do is prevent you at the end down here is give her that payer system. And we'll talk about that as well. And then we're going to, again, solicit for input from each of you on what you think needs to be done. So the initiative would have it about access and whatever else you have want to talk about the healthcare system in San Diego, whether it's just regular healthcare or mental health. I want to know exactly what you guys are thinking, what you need, and what we need to do to go to the county to talk about, to change some of these things. So talking about the recommendations from the last meeting, a lot of things came up about the medical practitioners. A lot of people talk about when they go to the medical practitioner, the doctor doesn't listen to them. They try to talk about what their symptoms are. They kind of ignore, they talk over, and so they all feel that they're being heard and that they're treated the way they need to be treated. So they leave that office and they're not getting the care they need, and they end up getting worse. And sometimes they end up dying because people don't diagnose them correctly. So how do we change that? So one of the recommendations for that was we want to create a model we call promotora model, where people go to a health navigator per se, or go to your visit to actually talk to the doctor for you to explain things and make sure the doctor explains to you what's going on. What your treatments are, why did they give you that particular prescription? What is that prescription going to do? What are the side effects? In other words, we want to make sure that the doctor understands that they're treating the whole patient, not just the symptom that came in with. And that's one of the things that is missing in a lot of healthcare. In other words, if I give you a prescription, do you have the money to buy that drug? Do you have food at home? So you can eat nutritional food to make sure you stay healthy. You have transportation to come back to the thing. These are things that need to be asked, need to be talked about, and this health navigator will also make some well-care visits to your house once you get home. Are you doing what you're supposed to do? How can I help you get that medication? How can I help you move to the next step so that you become a well person, not someone who is struggling to do what someone else tells you going out and listen to what you're saying. So that was one of the recommendations. So what we've been doing is we've been looking at programs that are out there. There are several programs. Howard is a really excellent program that are training what they call health navigators. You have a CS program of the not in the community is the way they should be. And there are curriculums that are developed. So we want to develop a curriculum to certify individuals to be health navigators. And one of the things we have to make sure that people understand is that because of the HIPAA, you have to agree that that person will go over what's going on and be able to hear the issues you have. But you will always have someone with you to be able to navigate your system, to be able to ask the right questions, to be able to submit from the physicians what's going on. I've been in healthcare for a long time, and when I go to the doctor, my doctor comes in with a computer, barely listen, and he's writing on the computer while he's talking to the wall. And I will stop him and say, okay, wait a minute. You and I are just talking about what's going on with me, not what's going on in that computer. And you have to be able to do that. A lot of people are afraid to do that because they look at this physician and they're afraid to ask those questions. But that's what that navigator is going to do. He's going to act your book train. He's going to push that person that can be with you. So that's what we're looking into that now. Hopefully we can bring those programs into San Diego to start getting people certified in these things so they can go with you and can access that information on everybody's website. The other thing that we talked about is low-income families, they have to choose between eating and going to the physician. Do you have money to go to the doctor? So how do we change that factor? In other words, if they don't have Medicare, if they don't have health insurance, so we need to look at some foundations that can fund some of these programs that can help support some of these families, and also making sure that the programs that are in the county they're supposed to help individuals with low income are doing just that. Because when you look at the data, that's not happening. They're not serving the individuals, they're not providing that service, so people are missing out on things that they're supposed to get. And the bureaucracy is so congested, so hard to navigate that you really can't figure out what's going on. So you end up giving up. So this is something we want to make sure that's changed. And again, being able to give you that information and input. The other issue that was brought up is the lack of access to mental and behavioral health care. So we know that if you need mental health services, not only in San Diego, but across this country, it's almost impossible to find it. There was a report in 2020 produced by the San Diego Health Department about the lack of professionals in San Diego, professionals to provide services, mental health services. Today, there's an 8,000 personnel deficit in San Diego to serve where we are today. So they don't have enough people to do work. They don't have clinics to staff. They have such a bureaucracy when people do serving that they can't really serve the patient that dealing with the paperwork and the other things they have to do. So we want to change that. We want to come up with a program where people can be certified as therapy professionals to provide mental health services. But the county has the money. They were given a large grant from the state to do this, and they have not used that money. So we want to make sure they understand that these people are going to be trained. We want to make sure there's a practicum sites that are put together, school system, and various other places that people get trained and be hired. So if you have the money, then hire these individuals. There was no excuse if you don't have enough individuals if you have that money. So we want to make sure that they don't want to take that off the county's plate, claiming that I can't find income. So we want to go into the academic institutions here, UCSD, San Diego State, et cetera, create these curriculums to provide certified professionals to be able to provide mental health service. People like that, need to be put on that list, need to be paid. And the other issue that we had was clinic availability, the times that the clinics are open. That was something else that was brought up at the first meeting. A lot of these clinics are open 9 to 5 of the day. You're working, you can't get to that clinic. So we went talk to the county about opening up night clinics, opening up mobile clinics, going to where patients are, so that you can get to see community with mental health services, or you need regular health care. You can go to these clinics after hours and be able to get those services. So some of those are things we're also working with the county on now. So those are the issues that were brought up at the last meeting, some of the recommendations, some of the things we're trying to do now to deal with those recommendations as we go forward. So do I have any questions on things we just talked about? Comments? Well, you guys can definitely comment. Yes, please stand.
Good evening, my name is Kia. I have a couple of just jotted down comments. The list was long, but there's a couple of things. In terms of like medication, I think there's issues with like refilling medications. Can y'all hear that there? Yeah. But it is issues with like refilling medications. The loopholes of like you have to contact your doctor, get permission for the pharmacy to refill the prescription again after 30, 69 days. And if transportation is an issue, then you can't continue to get to the pharmacy, or if the pharmacy is closed. So that causes a gap in getting your medication. So I think that's a concern. For our students that are majoring in psychology, one of the things that I know my peers struggle with is the low pay of supervision as psychology majors. And so a lot of them had to go and get different jobs. They got psychology degrees, but could not afford to work $12 an hour to get supervision, or maybe even for free, to continue to pursue that career. So if there's even a budget line item that can go towards making sure that there's an equitable amount of pay to get that supervision for psych majors. And then with case management, I feel like there should be more markers where comorbidities or including, and maybe not with comorbidities, economic status, at-risk statuses, whatever could fall into a category where you are automatically assigned a case manager through the health system that is like monitoring, like you said, what are the medications you're taking? Okay, that medication gave you these side effects. Let's try a different one. But you're still talking to your case manager who's helping you advocate, helping you renew those appointments, making sure your referrals are going through. You're not waiting 3 months for a referral or for someone to call you back. So I appreciate the list that you have, but those are just some things that I would like to see added to it.
Thank you very much for your comments. As far as the case management is concerned, that's where the health navigation will come in. They're going to be assigned to the individual person who work with them throughout that process. So what medications or whatever, so the transportation. So that's what I meant by treating a total picture, not just symptoms. Any other questions? Yes, sir.
The guiding of the health equity committee for the sending of Beverly, what is it? The name of that anonymous here. Is it, you said in county revenue health equity committee of
Health and wellness committee company what you feel.
and how would it be just contact the committee?
You contact everybody if you want to be on the committee. Everyone is welcome to be on the committee. We have about probably 20 people on this committee now from different health agencies and people within the county, and we'll get a lot of input on what we need to do. So everyone is welcome to join because we want input from everyone because it's the community that we're trying to serve, not just us. We're going to do it the other way. And my background is in research, and one of the things that I've always seen in research is we go out and tell people what we want to know. We never ask them what they want to know. So we used to call that helicopter science. We'll go in and write our paper and they run away. But we can't keep doing that. We got to go in and provide changes. If you're going to do research, if you're getting money from the vets to do a research project, then you can eat the community better than we found. And that doesn't always happen in African institution. Yes.
So, one of the things that I heard was that there's some capacity constraint, limited access to mental health care. And my question is factoring like the solution process, are there considerations being made to how to write it is taking the pipeline? And I say that as we have people who are going through the process of being trained as mental health professional who fall off either because of the inability to sustain themselves logging into hours that they need in order to get the credential, or not having support to scaffold them through the licensure then leaves.
That's a good point. And I think that's what I'm talking about, setting up private sites. So in other words, the San Diego School District needs mental health workers. That's a practicum sites that we can set up that they could be to going through their hours. And at the same time, when they finish those hours, we want to make sure that that site hires that person as an employee. So they're going to try to negotiate salaries. Well, so
If I may, let me also recommend consideration of some test prep before, because there are some people who are very capable who are just not good testing. And as many of us know, have taken different types of credentialing exam, not an understanding how the test work and how our building the past them.
there's a lot of this happens on the test taking the American. And if you have got grad school and take graduate exams and all that, or MCATs, there are programs that will help you take those tests and can actually create this and everything. It's the blocking test technique and make sure that you have practice tests and so that's what most of us got through.
It's a
Well, just to kind of piggyback on what you're saying about the pipeline of individuals coming into the profession, I think there's a bigger issue at our universities that are training individuals that would possibly go into the pipeline. If we really look at what is going on at the universities, the faculty at the universities and who is on the faculty at the universities and how some of our students are being treated at these universities, that is also contributing to the pipeline of what is happening in our communities and the shortage. We talk a lot about the need or the desire to have clinicians that look like the community that they serve. But there's a reason why this isn't happening. And I think we have to look a little bit further and peel back the onion a little bit and have a real conversation with another group of individuals as to what is happening in the classroom, in the admissions process. Why aren't those students finishing? Why aren't they applying, to the programs? Why aren't the universities more diversified in the faculty members that they have? I just think that there's a bigger conversation that is contributing to some of these factors that we're seeing. And I'm saying that as a core faculty member of a university and having some lived experience is a larger conversation.
And if you don't mind, Zach, I'll just add to that. Even if you take a poll amongst all of us in our graduating classes, how many of us in terms of African Americans there were, and I know for me in each class, there were about 2 of us, 1 to 2 of us, of sometimes 2,000 or 3,000, right? That's in nursing programs and programs in universities throughout our nation, as well as specifically California. And so Dr. Vanjie pointed on many different factors. And even though at large, we know that systemic and structural racism is woven and embedded into so many different processes when it comes to education, socioeconomic statuses, healthcare, you name it. But there are a lot of intersecting factors, and I think that is the beautiful thing about us being able to have these type of forums, these type of conversations, to be able to better understand from a community perspective, a self-healing community perspective, how can we approach some of these issues?
I just wanted to share as well that our education system really is designed to encourage communities of color to participate and be in it, because most of it's designed for affluent and young individuals without any failing challenges, without any who've really had all the privilege of getting to groups, where communities of color have family issues, we have economic issues, some other issues. And I remember when I was going in the 9th grade, I was one of 3 people in San Diego State Graduate School at that point in time. And the hoops you had to go through, the requirements that you had to be a single individual and reach out. I wasn't single. So the challenges that you have and the systems that you're trying to impact really are very pronounced, are real. And oftentimes we try to make excuse that it's the individual, but it really is the system that they're trying to really get to it. I actually had a couple of things too on some of the services. San Diego County has a psychiatric urgent care. They've actually got PIP operating. They got 3 psychiatric urgent care centers that are supposed to, at any time, any given time, individuals can go into who are having a psychiatric crisis, can go and get served. Now, I believe there is not one here in this area, which is a challenge, because at times if you're looking for your loved one, you have a loved one who's having challenges, and you don't know where to take them, usually the situation gets worse, and we end up calling the police, and that usually ends up badly. So we really have to make people aware of where they can go, what services are available out there. My agency works now with one of the large health plans. We have community health workers going to the homes and doing very much what the health navigators do. My staff go to the home and help them make doctor's appointments, take them transportation, help them understand what's services are available to them, what prescriptions mean, helping them understand the value of tracking their blood pressure and all these other things. That has to be expanded everywhere. And everybody should have the opportunity to have someone to help guide them, especially when they're maybe a senior, maybe individuals living by themselves that don't have the readiness to know exactly what questions to ask and what to do. If you are a part of certain health plans, you can have your medications delivered to your home. You don't even have to leave the home. But unfortunately, many people don't know that. You can get that service so that they can accommodate your needs. So we have to really insist that the services are going to be universal for everyone. Because there's a lot of services out there, unfortunately, we're just not able to and knowledgeable about how to access them. And I talked to Dr. Luke Bergman, who is the Director of Health and Human Services. He's going to say, well, we have that, Daffy. We have these services. And he tells me that all the time. But I said, if people don't know about them, what value is that to them? There's no value to them. So really, we have to heighten education and awareness of what is available so people can begin to access it. And they have to be customized to the individual needs so that people can have some value in the services that they receive.
Yes, sir.
Go ahead.
Yeah. I just feel I need to say something. I did my part. Okay. I spent over 13 years in prison. In and out. And after that, I went to San Diego City College, got my associate. I went to Springfield College where I met that beach brother and he got my bachelor's. Then I went to San Diego State. It got my master's in clinical counseling, and I'm 300 hours away from my license. But the thing is, all I ever wanted to do was work in my community for people that look like me. That's all I wanted to do. I wanted to repay and make amends to my community, to be there too, because I know how important it is to see someone that looks like me. That's why I'm sitting here in the position that I am now. But it was devastating to come to my community and there was nowhere to go. There was one person who had an office where I could have got my hour up on Federal Euclid. And I know he got issues or whatever. I don't know why he no longer exists. But he looked like me. That's all I wanted. And then that was gone. I heard capacity the other one talk about capacity, but where are we? You said the county's got $500,000 that they spent for this community, unless I misunderstood that. Why not? From what I understand about the process, the state gives the county money, the state saying spend that money. Is it because there's nowhere to give it in the community, or what? Or are they just evil, or what's going on? I don't understand. Why can't I go to work? I went to work for the only black drug program that I in San Diego until I couldn't do it anymore. Okay, but other than that, where are we? Why aren't we more visible? Why are we more? I mean, I could go to San Diego Health today. I could go to Family Health Center. I could go to, if I was Hispanic, I wouldn't have no problem. I'm not saying anything other than I'm proud of what they were able to do. But I don't see it for me. That's all I wanted to do. However many more years the good Lord done going to bless me with, was to come back in my community and let people know that we do this shit. Where are we? Where in my community can I stand and do that? That's why Casey said JIREH. That was like, really come find out what they talk about. They got to get in there. I don't know. I'm hurt. I'm lost. I got kids and I got grandkids. I want to see a future for them. I have to think positive. I have to think that things will get better. I have to think
that we will survive. I have to believe that because I have them in my life. But what the hell going on?
If you don't mind, Sam, do you mind if I speak to that a little bit? I want to say thank you so much for, number one, sharing your story. And I think it's interesting, even for Jireh providers, number one, it's Hebrew for God is my provider. And it also stands for Joint Initiatives for Racial Equity and Health. It is actually, your story is very similar to the genesis of our story. We, like I said, have been in practice 20 years, but during the pandemic, when we were trying to meet the need of making sure that for those who, it was very controversial, but for those who did want access to testing, treatment, and vaccinations, we wanted to make sure that we were able to serve as somewhat of a safety net provider to be available. But when we got attempted to get out there, we couldn't find us, right? And so we had to understand, how could we meet that need? And if we did meet that need, would our community take advantage of those accessible services? A lot of what you mentioned is really the thing that fuels this whole panel in terms of showing up for our community, making sure that there are programs and resources and services available to meet those needs. I do think that a key part of that is awareness of these resources, which is, again, a large part of the reason for this platform and this forum, is to make sure that with all of the services that each of us represent, as well as our counterparts and our partners in the community, that we are aware of, making sure that we are pushing those services and those resources out there. The other part of that I want to speak to is the fact that African Americans are only about 5% of San Diego County, right? And so we are fractured within San Diego County and all of the regions and the sub-regional areas. So oftentimes when we see programs and services that do come forward from our larger health institutions and entities, they oftentimes, although they receive large amounts of funding, the greater impact does often get displaced or placed on other communities like the Hispanic community. And so while, yes, we are happy to see the needs of other underserved communities get met, we do understand that there is a great need for our community as well. Yeah. And so we need to meet the needs. So I'm happy to all of us will be happy to take your information afterwards so that we can partner with you, because we do need all of us to be able to stand in the gap to push a lot of these collaborations and services forward.
Now, I'm going to do my best to try to respond to what you said and not get emotional,
It's just an emotional issue.
because I lived it and I know exactly what you're talking about. It's a little bit of a history lesson as far as mental health services in Southeast San Diego that this gentleman is speaking on. As a community, we worked really, really hard to put mental health services at the forefront in our community. We worked together, we worked collaboratively, we invited the county to our community to sit at our table, to have some real honest conversations, and we pushed for funding. And as a whole, as a group, and Daphne was part of that effort, we were successful in that, and we were making some really awesome strides. A lot of different factors came into play and that fell apart. For whatever reason, 10, 15 years later, it's almost like nobody doubled back to try to reinvest in that effort and reignite that same sort of energy that we had as far as mental health in our community. And to be honest, I don't know if it's because as a community we aren't as united as we once were. Because I got to keep it 100 with you. We roll.
I got caught up in that. That's what's part of what motivated you.
I mean, all of this people working in silos, that is not how we rocked. Not at all. We all were arm in arm. We all linked up. We all were one voice, one sound. We had one message. We were clear about what we wanted to see happen in our community as far as mental health dollars and as far as holding the county accountable, and we did that. Folks got a little beside themselves. It went sideways. And then there was a new generation of folks that came into it. And, you know, it's some of those people that I serve as mentor to at right now. And God bless them. I see them fighting the same fight. But nobody can do this alone. If we don't all get together and get on the same page, we're going to be having the same conversation 20 years from now.
Right.
We have to get together. But it's very real. As long as we keep trying to do it in our silos, the county will continue not spending their money. We will continue to, unfortunately, have, conversations with my man right here. Like, I'm sorry, we don't have an agency in the community in this zip code, in this address for you to support the services. And going back to what was being said about night services, understand the game. The county services are offered from 8 to 5. Be available 8 to 5. All community-based organizations who are getting pennies are at work right now. Those small community-based organizations who get their $10,000 grants and they're excited about it, their doors are open right now. They are seeing clients right now. But as a whole, we as a community are not advocating for them. We are not pushing for them collaboratively. All of that crabs in the bucket and people backbiting and all of that, like, we have to get it together. Like, we got to have some real conversations. Some of this nonsense I see on social media, how people in the community getting at each other, like, are you serious? Are you serious? Like, man, we have to have some real conversation. Yes, the county, we have to hold them accountable. They have some purse strings. They have some checks that they need and should be writing. Yeah. But we also have to present ourselves as if we are ready and able to be able to do what's right with the money. Because let's keep it a buck. They wrote a check before. Things went a little sideways. So we got some regrouping to do it. It's been 15 years we haven't regrouped. Folks is on social media looking crazy. And have we as a group pulled their coattails and be like, if you don't get over here and sit down, knock it off. Like, at what point do we start palate checking each other? Like, you're out of pocket. Like, you are out of pocket. Like, when do we have those conversations? Like, I'm all for wanting, I'm all about the bag. I'm all about the paper chase. But we gotta get right. I can't hold anybody else accountable if I'm not holding my people accountable. I can't go knock on somebody else's door if I know that my whole tribe is looking crazy. We got to go right. That's like you going to church and you ashy and you ain't put the grease on your knees. Moms ain't going for that. You got to get it together. This is the same situation. We have to get our house in order. It is some things we have to get in order. And we keep skirting around the issue, and there's some folks over here acting the fool. We let them act the fool in the corner, but time out. It's a reflection on all of us.
It means one, you gotta understand it's like, because you're talking about things that happen with teenage stuff. We had the ox that are in the night, was very focused on mental health, and it was highly functioning. There are a lot of people that came through the hot center and needed it as the points that they had to close their room. And so now we're at a time where people understand it or sitting there on money. And, while we're talking about access and capacity, we also need to think about the fact that
if you break your leg after 5 p.m. in South San Diego, you got a long way to go to get help.
Well,
So I think, one, understanding the scale and scope of the problem. The other one is, talk about silos. Part of the issue is we have a tendency to disconnect from history and pretend like stuff is not new. It's the stuff has happened before, that we don't have elders in our community who have already built the systems that we're trying to create from scratch. And so part of this is, we talk about, me, part of that is understanding that we've got a wealth of knowledge and experience at our fingertips that we do not have adequately left.
I tell you, young people that all the time. Back in the day, I wouldn't take no meeting unless I wait to talk. This month I need to talk to you for a minute. Tell Bozy, can I holler at you? I'm not talking to nobody unless I talk to my elders. I'm not doing it. These young people willy-nilly, all I gotta be with Susan. What was you talking to you? Why? That is wasting your time.
And not knowing that what you're doing, you're over here asking for $500 for a $5 million problem, and there are people addressing it from the scale that it is to be fretful. In fact,
I just want to bring it down even to a little bit different level. Because there was a assistant principal in Chula Vista where I lived now, who had a son with schizophrenia. Her son was very psychotic. And he would go this cycle to this psychotic episode. So he was in one of his episodes, she was trying to get him help. She was taking him to the emergency and then seeing him for a minute, so I'm home. And if you know anything about mental illness, a person, when they're sitting in front of a bathroom, sometimes they pull themselves together for a minute and make themselves appear less impaired than they are. So they sent him home. He started becoming agitated and violent toward his mom. So she brought him back to the emergency room trying to get him help. They sent him home again. He stabbed her to death and then stabbed his sister to death. And then she was an assistant principal who had been trying to give her son help for years. And the system made him jump through hoops. And even though she was a very educated person, if you can't get through the right door and you can't get the right kind of medications for it, don't matter what that at all. Because for you, that crisis is so powerful. And when you have a loved one you love who is going and threatening to kill you you're in an active survival kind of thing, that's a serious matter. So it's not about theories and discussion. It's about how do we get services with people that have been needed when they need it. These systems here, you have to jump through many hoops to get care. In emergency room, it's the only place people living to it, and that's the worst place to go. So we have to really say we have to have comprehensive system that people can go to, but they need help, especially mental health. And mental health is not a linear condition, because you can have periods of lucidity where you seem like you're doing well, and the next minute it's changed. You can have people have degrees where they like with bipolar, you could have high manic kind of behavior, and you think everything's wonderful, and you crash, and that person goes into very deep psychosis. These kinds of things occur, and when you are in that situation, how do you help the loved one? How do you help the individual? What are the services available? People don't know where they are, and it's not available to them. And some of our clinics that the county has, people have a two-week waiting list.
Yeah.
And if you're in a psychiatric crisis, 2 weeks, 2 minutes is too long. So what I'm saying, we have to make sure all these systems serve us better. And
If there's a provider in your neighborhood that's supposed to be providing services, do we make them accountable to what they're doing? We need to tell them they need the service better. And we have to insist on it because there's no reason we shouldn't get the same care everybody else gets.
So I want to thank all of you for your comments. If Dr. Robinson, do you want to add any of these comments? I don't want you to be left out.
What we need to talk about is the possibilities. The possibilities will be realized when we get input from you. To take that input from you in terms of what you want, how you want to get it, where you want to get it, to the county. I know Dr. Bergman, I've had some conversations with him. He can't get away with me by telling, well, those services are out there, because I tell him, you know what I know, they're not. They're not in the places where they need to be, and let's figure out what needs to be done. This is about telling the county, these meetings are about telling the county, okay, these are problems within the community. Those services that we need in the community are not there. And here's the things that we'd like to have reimagined on how we get those services. That's what's going to be important. Then we have to hold their feet to the fire. You know, it's in this San Diego city and county, it's very difficult to attract people from outside. Housing prices are just ridiculous. The mortgage rate is up to 7.5 or even higher than that. And attracting people here is difficult. However, it can be done. It can be done. But we have to then insist that it does. Recognize that there are needs and there are things that need to be done so that we can better serve people. And so perhaps we need to get all the healthcare providers together with the person who's supposed to be handling that, Dr. Bergman, and let him listen to you, not us. Listen to you. Let you tell them what's needed and what needs to be done. And then the county has to do it. We have to hold their feet to the fire. Now, if they say we can't find appropriate people, okay, that's been a long-term evolution. I've heard that 50 years ago. When I went to medical school in Philadelphia, there were 7 African Americans in 6 schools of medicine in Philadelphia, Pennsylvania. 7. Okay. When I came to San Diego as an interventional cardiologist, university trained, I was the only black person here in this county. I wasn't welcome, but I made myself welcome. And so, but it can be done. I look at one institution that looked at this disparity some years ago, Duke University. Everybody's heard of Duke. Duke's a great academic institution. They made the proposition to their faculty from their president on down that we were going to make Duke University, both in terms of students, in terms of faculty, and everyone else, look like the communities that we served. And so before we knew it, Duke University had 12% to 13% African-American students in their first year class in medical school. Their faculty, 13% African-Americans. And some of the faculty members are folks that are writing significant papers that appear in the significant journals. Okay? Yeah, if you're not at Duke University or some other institution, you won't get a chance to put your paper in to be in the journals. And so it can be done. And so I don't accept that. I know the directors of all programs in cardiology in the city, in San Diego, and I get on them. Sometimes they don't like to talk to me because I'll tell them, look, you got this program. When's the last time you had a black person come through your program so that we can get that black person in this community? You know, we just had one guy tried to recruit here. He finished UCSD in the neurosurgical program. In fact, he assisted on my operation. Hope he wasn't the one that made a mistake, but anyway, I had surgery on my neck. But anyway, I tried to get him to stay, but he got a better job in Arizona. But the important point about what we're trying to do here, we need the input from the community to say, this is not happening. And then we have to stay on people to make sure it does happen. And if you think it can't happen, you're mistaken. This is how things get done. They don't get done from people like me. They get done from people like you. Okay? You have to make your voice heard. We'll take the information back, and we'll make your voices heard. At the appropriate time, we might have some meetings with the folks after we present the information to the county, where you can make sure that they got the exact information we want to give them. So that's how we get things done to move on. You know, we all have some stories about getting through this system. You know, I got through a system where most of the time I was the only black person around. And were they happy to see me? No. But I was able to get through. I persevered, and I managed to have a fairly decent career here in San Diego. So it's possible. My purpose now is to educate the community as best I can, to pass on some of this 50 years of knowledge I've gained, so that folks can be better educated about health and what they need to do in terms of the betterment of their health. And for the young man I talked to who's going into medicine, congratulations. I think the most important thing, and I'm not going to say it well, I'm not going to say it well as the quote win, but one of the things that is most important, it's not riches, it's not any of those things. It's what you do by the time you finish that lifted or helped someone else along the way for their betterment. Now that's the best thing you can do as you go along. And I just hope I've lived up to that, and I'll continue to do what I have to do that.
Thank you, sir. Yes, ma'am.
So, hello, everybody. My name is Charlotte Crumley-Arrington. I am San Diego's motivator. And what I need is a safe place for people to come to be able to say where they're hurting mentally, because a lot of us have issues that we're dealing with. If you're coming out of prison and you need to know how to get your life back on track, we need a safe place for people to open up and say, I need to know how to get back with my children. How do I do that? How do I communicate to heal these relationships? And that's where I come in. That's what I write books about, you know, people that are hurting and how to heal themselves within and how to mend those relationships on the outside. I'm not a doctor. I have a degree in communication. I've been working in healthcare the past 7 years in pharmaceuticals. But my heart, I'm a motivator, and I motivate people to follow their dreams and to do what God put them here to do, because that's not something that we have. You know, a lot of times we tell people what we want to do and they tell us that it's not possible. And so I'm that voice that tells you it is possible. I don't just talk about it, I am about it. So I need help in getting these people together to know that they're in a safe place where they're not going to be berated for a mistake that they made, because nobody's perfect. But where a lot of people are under the delusion that everybody is perfect and every mother's perfect and every father's perfect, and people can't sleep at night because of decisions that they made that affected their children. And they don't know how to deal from that. And children are holding their parents accountable for mistakes that they made, and not knowing that when they become parents, they're going to make mistakes too, and their children are going to be upset with them about that too. So we just need a safe place. So that's what I need help with. I put it out there all the time. I'm holding workshops, but I'm not getting people to come because people don't want to admit that they're hurting at night, that they can't sleep at night because of something that they did. So that's what I need help with. And I am for the community. I grew up right up the street, and I got my degree from Howard University. So I'm about it. So that's what I need help with, is getting us to come together in a safe place so that we can heal internally. That way we can we can support the community. That way we can build healthy families. We can heal generational curses that are in the family. So that's what I need. And I thank you guys for being here. I thank you for this forum.
Well, I'm going to answer your question. I'm going to get you some help. The lady that's sitting behind you, Key,
Yes, this is the money.
you need to join our Health and Wellness Committee. you need to join our committee and bring your voice in there as well. I think that's important. So get in touch with Key, find out when these meetings are, join the meetings, put your input in there, and expand the things we need to do, because it's going to take all of us to do this. And that's why it's important that we have a committee across a lot of community agencies. We need to form coalitions. We need to work together. We need to support each other. Because everyone has different expertise, and those expertise are going to get us to move to the next step. Deal with what Vanjie was talking about earlier, about people who go off the rails. I think accountability has to go all the way down from both sides, from the people with the money, for the people who want the money. And again, I got Dr. Robinson and I are probably the oldest people up here, except for Dr. Bryant. How you doing? Huh? And when we were in college, a lot of us got out of the service in the 60s and we went to school in the 70s, and we were insane in college. We asked for what we wanted. We fought people. We took over buildings. We did whatever we wanted to do to get what we needed. And then they realized something very important. He said, we don't need to get in any of these fools in school anymore. So we're going to recruit those quiet folks that don't say anything, kind of go up. But, we haven't gone away. So we have to continue to do the same thing. And so for me, I think the thing is, that's why we're asking for your input. When I go to the county, I want to make sure when I look back, I got folks behind me. I don't want to be the only one there. Or you're speaking for yourself, or you're speaking for the community. I want the community to know that we're speaking for you and you guys are there. The county can be held accountable, because I think the gentleman talked about money coming from the state or the feds. That money has earmarks attached to it. It has regulations that are required for them to give the money out. But they let these contracts out, and they don't hold people accountable for the things they're supposed to do. I'll give you an example. There is a contract out now for a program that's supposed to be putting together resources for people to be able to access if they need help. But none of the resources that they have are in this community. Not one thing. Now, this person came to our meeting. I'm not going to throw out any names, but they're talking about, we need your help. I said, what do you need our help for? You got the money. Why aren't you doing what you're supposed to do if you're supposed to have resources across the counter? I don't have the money. They paid you. So we need to hold the county accountable for those contracts. You're supposed to have deliverables. If you get paid, are those deliverables coming in? Are you changing what you said you're going to do? You're supposed to have a purpose when you write your grant. I'm going to do X. Did you change anything? If you didn't, why do you still get the money? So the county keeps letting these contracts out for people who are not doing what they're supposed to do. So we got to go back to the federal regulations and say, okay, this is what the federal regulations say. Are you holding this accountable? If not, then we need to call the county auditors. We need to call the auditors to come out and say, hey, what's up? Because this is the business I've been in for a long time. And the auditors will definitely make changes. But you have to be able to say, this is what's going on. You don't just accept. And as long as you don't speak up, it will continue to go the way it has. That's how racism works, folks. If you don't speak up, then I'll keep pushing you off the sidewalk. And when you decide not to step off the sidewalk, then I'm going to wonder what's going on. Why are you asking me to move out the way so you can walk? So this is what we have to do. We've been accepting this for a long time, folks, and it's coming back around. People think that if they erase history, somehow we're going to be there. You're indoctrinating me if you talk about Malcolm X or Dr. Martin Luther King, but aren't you indoctrinating me if you talk about Dr. Robert E. Lee or Civil War? It's the same indoctrination, but it's on the other side of the street. I'm an old man now, and I'm going to tell you that right now. I'm 77 years old, and I don't really care what they think. Our help was ours, and I'm going to make sure we do it. And as Dr. Robinson said, when I leave here, I want to be able to say, I did something, I gave something back. And that's what this is all about. So, I don't want to hear it anymore about, they're going to erase, they're never going to erase it. Because you can't erase history, you can't erase what already happened. You can play these games all you want, get these legislations, but it's not going to work. You're just going to have a bunch of folks who think they can do something, and they're going to get hurt when they try to do it. And I think that's where we have to be going. So I know I'm preaching up here, and I'm sorry about that at the moment. But again, you get tired when you get older, and sometimes you don't care what you're saying. So, all right. So I am challenging all of you to step up with us, to come to the meetings, to work with us to get this together, to look at our websites, to give us some input. If we're not moving in the right direction, tell me, because Vanjie's going to tell me. All right? And I need folks that are going to call us out and make sure that we're doing what we're supposed to do. That's the bottom line. So, we're not here to just have a meeting. We're here to get input to change something. And I think we need to do that. I live in Los Angeles right now. I grew up in Los Angeles, but I went to school in San Diego. When I came down here, I'm going to tell you the truth. I thought I had gone back in time. The way the community was fragmented, the way that people acted, the way they acted like they accept those that they were getting. I said, what is going on? And things did change for a while, but it's kind of gone back to the same thing. It's like we keep accepting things that we shouldn't be accepting. Why are kids at school who need help? I'm thinking about committing suicide, but I can't talk to anybody for a month. Well, that's not going to work because they're not going to be here. So, we need to make sure these services are there for our kids, for ourselves, for the elderly. We've put a lot of energy into living and have a lot of wisdom that we need to take care of them. That's not happening either. So I'm putting a challenge on all of you to challenge us, to challenge yourself, to move to the next step. And I think it's important that we do that. So we're going to continue to have these meetings. We'll continue to ask for your input. And, and on a phone call away. We're going to be putting stuff on our website. We're going to be calling you up. And all of you who signed up, you're going to be hearing from us. Because we need all of you guys to make sure this thing moves forward. So, Any other questions before we move on or Dr. Brown?
Talk about the toll that fentanyl is having on our community. I know it's all over, but specifically in our community, the toll was happening. And make sure that we tell each other that to share, to spread the word that the kids shouldn't try drugs that are not prescribed for them. Because it's so dangerous and now they're lacing it with something else. We need to get that out in our community about the danger.
No, I agree with you 100%. I think the thing is, if you look at the data, not only in San Diego, but across the country, fentanyl is taking people out faster than anything else. And when you talk to a young person about drug use, and I work with a lot of foster care kids right now. They think they know more than you. Well, I'm okay, and I know where I'm going, I know what I'm buying. They don't know. Those of us who experimented 50 years ago, 60 years ago, we didn't have that issue. We got through a lot of this stuff. But this is something that's killing folks left and right. And really the fact that the school system has to have Louisiana available. All these people are putting North so people are already left and right on this stuff. It's getting, again, it's the same, it's what they're cutting it with because they want you to get the same type of feeling, but it was killing you. So you don't know what you're going to get from doing on the day two. And I just watched a documentary a couple of days ago about that, about a whole town. 80% of the people in the town were drug users. And the guy was talking about buying drugs, so when they cut the stuff up, you want to know what batch has what in it. So we can take one and the next time you're out there. So again, it is a serious problem. And I think we have to educate the kids more about not using this stuff. But why are they using it? Because mentally, they're having issues with discrimination, with poverty, with all the other shit around else. So they're looking for something to alter their state. And this has been going on for a while. So this is a very dangerous thing, but sure, this is what's happening. One other thing I wanted to mention to you, there was an article that came out of the Union Tribune, I believe it was a couple of days ago or last week, about mental health, access to the mental health system in San Diego County. And it's something that should made because it does talk about the problems of our mental health system. The gentleman that you mentioned, Newberg, is in this article. He admits that there is a problem. He admits that they're not doing their job in this article. So he knows what's going on. So these are things that are coming out now as an expose that was done by the Union Tribune. You must try to read it because it does have a lot of good information and it gives you ammunition to the things we want to do when we talk to the county about services. They're only there that this stuff isn't working. So how do we fix it? Okay. Lynn.
really important that we really focus on what Ms. Dr. Vanjie said, and that was about holding our family and our community accountable for when they are in positions to help or receive money and don't use it in the right way. Because sometimes we, even in the community, have a don't ask, don't tell, good old boy system, and we have people in positions for very long periods of time that have done absolutely nothing but got total funding. Yes. We have to continue to challenge that, and we also have to say, in our community, there's more energy around becoming cannabis dealers than to heal our young people, and that's why they are self-medicating themselves. Yes. Because it's not a drug problem, it's a self-medication problem. Yes. That the kids are going through.
Absolutely. Absolutely. And again, that's what I'm saying. Accountability works both ways.
And if you be told, if you talk to any young person, they'll tell you, our schools are not safe. They'll tell you in a heartbeat, they did any drug they.
Well, absolutely.
That's so he was like, you don't get it. Well, it was like, I go to that school every day. He was like, Mom, it's stressful. He's like, the anxiety when he was explaining what he was feeling, and then, the conversations we were having with the administration, he was like, it's unreal. But it ain't one thing.
Well, see, again, that goes back to, again, as we talked about accountability. If you're a parent and you don't know what your kid is doing, and then you want to justify what he's doing and beat up on somebody else, then that's your problem as well. You can't do this. You got to be a parent. You got to provide some guidance, and you got to hold that kid accountable for what he's doing. And so this is the important. I mean, I know San Diego is the same as LA. I mean, you go to LA, it's like going into school is like going into prison. You got to cross, you got the metal barrier, you got all this other stuff. It's like getting on an airplane. I mean, you might as well have TSA in front of the high schools. It's just that crazy. So how did we get to this point? I know, it's amazing.
That's more about the wraparound care services come for as a community. We're addressing all those individual needs for, moms, fathers, parents who do need assistance in other areas, our children as well. I also like to mention that even though, justifiably, we do place a lot of emphasis on the county is not the end all be all support, leveraging funding and different resources for us to collaborate and get things done. So with all of our degrees, education, scholarship, us partnering and leveraging each other to go for those opportunities needs to happen, but it is very possible.
Oh, spiritual.
But that goes back to our need for that collaboration and not working in no silos.
Absolutely.
Yeah.
Any other comments? Yes, ma'am.
I realized I didn't tell people who I am or why this stuff matters. I'm Dr. Alana Richmond. I'm an Afrofuturist. I do a lot of work on focusing our energy on the things that we can control, internalizing our space of control. And I say all that to say that all of these needs and all of these deficits are very important. They're very important to address. It is my hope that as we're addressing illness and how to cure or prevent it, that we're also addressing wellness and how to increase and enhance it. And, I have to plug my event. Hadn't said 2 weeks. This will be the 3rd year that I've done AfroCon this year. I added the Afrofuture because I want people to really understand it's not a year. Not that about us thinking about and imagining the future that we want and reverse engineer the process of identifying how to get there. So there'll be workshops, panels, vendors, exhibitors. I use pop culture as a magnet, and I encourage people who have resources that they want to share to connect with me, because my reason for being actually is to help us connect forward. I support and respect people that are focused on, I respect history, build on it, but I see the purpose of history is to inform us so that we make decisions, choices, engagement, actions, and behaviors that help us have a better future. And I feel like if we are doing that in everything that we're doing, then we're missing something really important. On the first year that I did AfroCon, 1,000 people showed up. It takes place around order at the Jack Robinson Salon. I've been doing the Afro Teachers in Lounge for 6 months. I've traveled places to talk about Afro Teachers. It's in Indiana was my home, and there's no place that I care about for people that I care about more than I do about the people right here at home. We are an incredible city with wonderful people and resources and services. And I think a lot of times we get so focused on what we don't have or what we're not getting that we're not fully leveraging and building upon things that.
For those of you who do not know Dr. Richmond, you need to know Dr. Richmond. Just in terms of things, in terms of educational things, one of my main peeves is that when patients have come to my office, sometimes they don't know the first question to ask, and they certainly don't know the second. An event is happening this Saturday at ECC, a boys and men's health program put on by the president of the Lincoln High School Alumni Association. It is from, I think, 9 to 2, and dangerously, they've given me a whole room to myself. And so I'll be providing a lot of information, so just come on by. Okay. And the other thing is that we're going to put Key and Al to work, because we need a directory of folks, services, programs, folks that you need to know in this community that folks don't know, so that you don't have to feel like a Lone Ranger all alone. And Lone Ranger won't be saying, well, come on, Tonto, we're going to go out and get these folks. And Tonto said, what do you mean, white man?
I must also plug Mental Health First Aid. It's a training program that our agency does for free for people, so that, and it's really for lay people. People don't have a degree or knowledge of mental health, but if you have a family member or yourself, you lead and you're in a crisis, how do you handle the crisis? What do you do? How do you get help? The training is a certified training that really gives people the tools to be able to help that person at that moment. So I want to make it available to everybody. Anybody can take it. Free, 8-hour course. You get a certificate in it, and it becomes valuable for you to be able to help a family member, a loved one, or yourself, or be able to get the help you need. So there's a leaflet to the back there. Make sure you take them and utilize it, because, again, in other communities, there's a high cost to the training. That here, they're offering it free. And Lutz?
I wanted to make a couple comments. One, that the fact that I know we do have a few folks from the county here, and what I would love to see is more RFIs come out, and that is requests for information. So when those contracting opportunities are available prior to contracting and procurement, that we are able to have more of a say in terms of what that looks like and helping to hold people accountable. Also would love to see our community be more proactive instead of reactive. We know that there is more to come down the pipeline in terms of rewriting history, harming our community. And so we need more of this, more engagement, more collaboration at this level. Also definitely want to do a couple plugs for our organization. We still have a COVID-19 program. And so right now, anybody in the community who is positive, we get them seen for free by the doctor via telehealth. We will get them their prescription. We will pick it up from the pharmacy for you and bring it to you. We also provide them with a COVID-19 care package, call it Sick at Home with COVID. That comes with a $40 DoorDash gift card, tea, throat lozenges, cough drops, gloves, hand sanitizers, masks, a whole package, really just to love on our community. We also provide groceries at the same time, usually about 3 or 4 bags with everything, that's necessary for that nutritional supplements. And then we follow up with you just to make sure that you're not hospitalized or have an adverse outcome. We also partner with Dr. Aflalo with Healthier Me and Many Shades of Pink Benny Shades of Pink, Wendy Sherrills, who put on a monthly health fair where we're doing free mammograms, free hypertension screening, cholesterol, diabetes care, all of that, as well as the COVID-19 vaccines and treatment, and a number of other resources. That is the first Wednesday of every single month. So I want to make sure that folks know about that. It's at the Jackie Robinson YMCA from 10 to 3, first Wednesday of every month.
Can you, you've done it?
And she has a new clinic.
Oh, and then IWC, Black-owned clinic. I don't have an address. I will make sure I get that flyer to Key in the urban to the urban league. Yes, but that is Innovative Wellness Clinic, Black-owned primary care clinic that's in our community.
So I'll be sure to get information to Key. I'll have some educational workshops coming up for parents. The first one is in a couple weeks. I am the expert of my child. I authored some parent journals, making sure that parents understand the importance of having receipts when it comes to navigating your child's education experience. So really encouraging parental engagement and advocacy. So I will share that information for those workshops that are coming.
Anybody else have anything?
Yep.
Lord, no,
One more commercial.
One of the things I've been doing is bringing information about COVID. And there's a lot of misinformation in the community. I've been doing this for almost 3.25 years for the Voice and Viewpoint newspaper. And we have Black Men and Women United. It meets by Zoom every Tuesday morning at 8 o'clock. They're going to let me talk about this on Saturday. But I want to remind everybody, COVID is not over. In terms of test positivity, just to give you an example, on June 6th of this year, we were testing in San Diego County at 4.7%. And that's below the 5% threshold that everybody says is good in terms of community infection. We're now at about 12% in this county, 12%. And we haven't even completed August yet. So COVID is out there, didn't take a vacation. And for those of you who think that you're immune to it, you're not. And do not get it, because then if you get it and you get real sick, you end up in the hospital. You may be one of those people who is at risk for long COVID. So I will stop there.
Thank you for that.
And there's someone over here.
you have a question? Your hand up?
I was just going to make a suggestion. So if at in time of not being able to see a therapist, I'm just wondering, like, what other support can we give to, for example, for youth? So one event that I did with my sorority was men who meditate. And I just had this for the community come out and just show the young boys, like, just how to be centered with your body, how to think through some of the microaggressions at school. I don't think it has to be all the time formally through therapy. So maybe they can train football coaches, basketball coaches, cheerleading coaches, barbershop program, barbershops, and we just get mental health conversation, normalizing it, even if they can't get to the profession. If it's like, we're going to do a 5-minute affirmation and have everyone stand up and do that affirmation. If that's the whole world teacher. So just not making it all or nothing. Like, it's not formal, so we can't do anything. So for those of us that are in the community, even for us in the workplace, like, what can we be helping our HR representatives do until we get that employee relation psychology appointment, which are back, you only get like for 5 of those, while you're still waiting on your PCP and your referral site, the mixing site is like backed up. What can the HR representative do for just wellness and that's so on Wednesday every other week? So those are just things that I think that may live well, say be able to try charter with like maybe the top 10 employers in San Diego, start there, test it out.
I mean, that's a good point. I think that's one of the things that I think a lot of us have been trying to do for a long time, especially when it comes to men and Black men especially, about their health and about their mental health. They don't want to talk about it until it's too late. So we seem to think that we have to be strong until we fall out. And I think that's the thing that we need to challenge each other.
John Henry syndrome.
That's it. Yeah, that's the we need to challenge each other. Those of us who are over 50, we need to pair up with those of us who are 15, 16, men, and talk about what it means to be a man, what it means to navigate this system and this world, and how do you be a man instead of being aggressive. And I think after a while you kind of figure this out, but you don't want to wait until someone is in the prison system before that happens. So I think that's something I'd like to challenge all of the men in this room, that, I'd like to set up something, some kind of Zoom or maybe a in-person thing with the kids in high school, a football team, whatever, and talk to some of these young men and find out what's going on. Why is it that you're having these issues? You go to school, you have a problem. Why? How do you navigate this stuff? You don't always have to fight. There's other ways of doing these things and other ways to be who you need to be. So I think that's the other challenge that we have, because I see a lot of this going on now in school. And, you got to carry a gun, you have to do this, you have to, and then they have no understanding what that means. So if you want to do this, get in touch with Key. We'll put this together. We'll link Robinson, put us in our right place, right?
It's hard. I definitely don't want to leave here tonight without placing emphasis on cardiovascular disease again. I know that is Dr. Robinson's background. Cardiovascular disease is the #1 killer for Black folks in Southeast San Diego. The interesting thing about that, all of our health inequities is a very nuanced conversation. Mental health absolutely plays a huge role in how unaddressed cardiovascular disease goes in terms of feelings of despair, racism, in the healthcare system and all of those things, right? But more than 50% of our community members are dying from cardiovascular disease, while only 4% of us are actually diagnosed with cardiovascular disease. So please know your numbers, cholesterol, blood pressure, other health conditions that are associated with it. Just wanted to make sure I placed emphasis on that. Dang, and I had another, urban restoration counseling. To the young lady in the green pants who mentioned about healthcare, again, back to the reason why we are here, it's about collaboration. A lot of us know other organizations like Mental Health America and Dr. Vandy's organization, who offer a lot of free services. And please do not underestimate the fact that these services are free. It is just coming from passionate people within your community, like this gentleman here who want to give back and make a difference. Urban Restoration Counseling currently has a program where they provide 16 sessions for free. And then they work with community members to do a sliding fee scale to help them get the help that they need. My medical director, Dr. Robert Gillespie, friend of Dr. Robinson's, a renowned cardiologist in Southeast San Diego, he has a personal testimony himself of how mental health has impacted his family. They also have a program where they're looking for Black and brown men in our community from 18 to 21 to provide them with a lot of mental health services. So it's a wealth of resources up here.
Excellent.
Oh, okay.
So I'm Dr. Willis.
So actually, that gave them that information to read out.
So I'd like to thank everybody coming. I really appreciate your attention, your input. And those of you who didn't say anything else, that we have some questions you can send to us. If you don't want to say it out loud, that's fine. But all of you are going to be challenged, because we're going to be calling on you to help us do what you need to do. This is a crisis. And as much as I do not like doing crisis, I want to make sure that we do things in a way that we can be proactive instead of always responding to a crisis. So we have to get better at what we do. And we can't be proactive. There's a lot of energy in this room. There's a lot of mind power in this room, a lot of skill in this room. And we need to tap all of that skill to get to where we need to go. So thank you very much. I appreciate it. Look at our website, your Urban website. The notes will be up. We'll get our community page up. We're working on our directory right now. And as we put that stuff out, we'll make sure that all of you know about what's out there in time. And if you have input, please do. If you want to join the committee, please do. Keith definitely will get you on that. Because again, all of us need to work together on this. So thank you.
Thank you.